Hi, I'm Heath Harmon from Public Health and Environment, joined by Joan Dieter, who is also from Public Health and Environment. We're going to talk a little bit more about a second goal that we have specifically to try to improve mental health for Eagle County residents. And so this goal is really at the core of what we do in public health and environment, and so it's prevention-based. This is all about how is it that we can actually prevent different forms of trauma in the earliest years for some of our youngest community members. So we're talking about from birth upwards to the age of 5. But nevertheless, what I'm going to ask Joan to do is talk a little bit more about expansion of home visitation, how that fits in to this particular goal, and then we'll also talk a little bit about our status in terms of where we're at with this particular goal.
Yeah, absolutely. So looking at a prevention of these mental health needs that we're seeing in our youth, a public health approach that we felt like was appropriate for us was to expand home visitation. So right now, with the birth rate we have, we could see about 25% of those kiddos that were being born, and we wanted to expand that to 60%. So in order to do that, we started a program called Family Connects, which launched last month, the beginning of October. And this program is a universal home visitation program, meaning that anyone that lives in Eagle County is eligible to receive this service in their home. 3 to 12 weeks post-discharge, a nurse will come visit someone in their home. They'll have a variety of different conversations about the health of the birthing parent, as well as the health of the family and the health of the baby. The hope with that is that then we can get folks connected to other resources that they might express a need in, so that down the line we can see better mental health outcomes for those families and those youth.
Fantastic. And so this program is relatively new, right? Just started in October, but nevertheless, from the middle of the summer up until June, we spent most of our time actually then recruiting and building the program. So at least right now, even though we don't have data to report in terms of those home visitations just yet, we are proud to say that we've got a fully staffed team, which includes 3 nurse home visitors and a nurse supervisor and a community alignment coordinator. So we're super excited about this and looking forward to our next video update where we'll actually have some data to report.
Yeah, absolutely.
Thank you.
Thanks.